at the Health Innovation Conference 2025 at the Venetian in Las Vegas, talking all things the future of health and health technology. And I'm pleased now to be joined by a key leader in attendance. He's the CEO of Headspace, Tom Pickett. Tom, welcome.
Thank you. It's great to be here.
Yeah, great to join you here at Health. And I want to hear from you as it relates to Headspace. What do you see as the number one challenge in the mental health space right now?
Yeah, the biggest challenge in the mental health space is frankly the size of the mental health epidemic, if you will. Nearly 1 in 5 people have a diagnosed mental health condition. And we know more broadly than that, that most of the population suffers from stress, anxiety, sleep, mood. And so we have a real challenge in terms of if this many people are affected, and by the way, the younger generation seems to be affected even more than the older generation. How do we solve this? And our current mental health stance is that we send everybody to talk therapy, which doesn't scale, right? We don't have enough therapists to address the magnitude of this kind of problem. And then frankly, economically, like we can't afford to have everybody have their own personal therapist. So we need a broader set of solutions, some new solutions to help make an impact here.
And to that end, what are the solutions that Headspace is providing to respond to this challenge?
Yeah, so at Headspace, we have a comprehensive mental health platform. We start with meditation and mindfulness content. Many people know Headspace from meditation and the history we've had over the last 15 years. We also now have Ebb, which is our empathetic AI companion. So you can actually talk to Headspace now and we can learn more about you and it's really helpful for like emotional regulation. We have coaches, therapists, and psychiatrists. So we have a full spectrum of care that we offer. And part of the reason we do that is that most people don't know what they need. They just say, I don't know, I need help with X. And so we want to be able to give people the right level of care at the right time. And that's going to vary. Everybody has a journey in their mental health, life. And sometimes you need more acute care and sometimes you just need help getting through the day, right? So our idea is like, how do we expand access, create a much broader set of tools that we can make available, and ultimately do that at a cost structure that is going to really help the system unlock access to many more people.
Mm-hmm. What excites you about the future as it relates to this?
Yeah, I think we are in an amazing moment right now, certainly with the technology we have available. I tell our team all the time that I think mental health tools and resources are going to look completely different 2 years from now that, relative to what they are today. We have a very limited tool set. The idea that you can now get much more personalized, you can actually have in the moment care through AI. I think we're just at the very beginning. But I am very optimistic that over the next couple of years, we're going to be able to develop a broader set of safe, AI-driven tools that complement the human care. I think the human care is not going away. Human therapists, we love our therapists. They're very valuable in the ecosystem. They're scarce, but we need a broader set of tools. And up to this point, nobody has changed the trajectory of like the size of the mental health challenge. And I think with the technology we have available, we have the first opportunity over the next couple of years to really change that trajectory.
Sounds like you are excited about the
I
future.
am excited about it. It's a pretty amazing time.
Tom Pickett, CEO of Headspace, thank you so much for joining me
Thanks
here
for
at the
being
event.
here.